Greetings to all. Welcome to another session of PhysioTV Classroom. Myself, Dr. Shivani Chutke, I am an assistant professor at Sanjeti College of Physiotherapy and Electrotherapy and Electrodiagnosis Department. So coming to our topic for today, we'll be talking about breast examination. So what is exactly breast examination? The clinical breast exam is a step-by-step procedure used in the diagnosis and the surveillance of breast-related issues, for example, malignancies. Coming to why do we need to exactly do breast examinations? So breast examination is a routine process which is one of the most important aspect of breast health as well as the early detection of breast abnormalities including breast cancer. Regular breast examinations, both clinical examinations as well as self-examinations, can help us identify different abnormalities as well as the changes in the breast. So before starting with how exactly do we need to proceed with breast examination, let's try to understand where we as a country stand and why is it considered to be one of the most important aspect or an important clinical tool which will help us have a better future with respect to breast cancer. So breast cancer is currently one of the most significant health concerns whose prevalence is increasing day by day. According to the National Cancer Registry Program report by the National Center for Disease Informatics and Research, in the year 2020, India accounted for almost about 13.5% of cancer cases, whereas 10.6% of them have actually led to the death of the individuals as well. The incidence of breast cancer in India has been rising steadily. Factors such as urbanization, the lifestyle changes, reproductive patterns, the eating habits contribute to all of these factors when considered. They have a severe impact, thus contributing or being one of the most significant risk factors for breast cancers. So let's talk about breast examination and how and why do we need to consider it. So early detection of breast abnormalities like cancers, regular breast examination can help us to deal with the cancer at a stage where the chances of the survival are at maximum for our benefit. Coming to awareness and education, many women in India still, especially who live in the rural areas, may not be aware of the signs and symptoms of breast cancer. So education through breast examination initiatives can thus help us inform them about what to look for and what is the right time to seek for a medical advice. There are a lot of cultural barriers. India being a country where there is a lot of geographical traits, cultural as well as social stigmas usually prevent women from discussing such topics openly, and they are still considered to be a taboo. Encouraging breast examinations and clinical examinations can thus normalize these conversations and reduce the stigma, and thus women should come out and talk about such subjects because these are the subjects which really need to be taken care of. Coming to access to healthcare, breast examination can serve as a very important entry point for women to engage with the healthcare system, especially the women who belong to the rural strata of the country. Unserved areas where healthcare access is limited, where a breast examination should be brought into the culture of healthcare practices. Through breast examination programs, women can be connected to the other essential health services as well. Coming to the preventive domain of the examination, breast examinations are a part of broader preventive health strategies. By incorporating them into the routine checkups, we can foster a culture of preventive health and encourage women to take proactive steps in managing and taking the charge of their own health. Now, let's talk about few guidelines of when exactly a woman should do breast examination. American College of Obstetrician and Gynecology talks about how clinical breast examination should be done at least once in every 1 to 3 years of age. Self-examination, whereas, has to be practiced at least once a month, which are again similar to the National Comprehensive Cancer network screening guidelines, which again suggests that a woman who is between the age group of 29 to 40 years and who are asymptomatic with no special risk factor for breast cancer should undergo a breast examination, at least a clinical breast examination rather, I would say, after every 1 to 3 years. The best time to do a self breast examination could be somewhere around 5th to 6th day of the menstrual cycle, whereas any woman who is undergoing menopause, any date it's okay for her to do a self breast examination, but there has to be a check on what day exactly she is doing the examination. Women again who are older than 40 years are at slightly higher risk for breast cancer with respect to the menopausal changes going on in the body. History of breast cancer as well as symptomatic patients are recommended to have more frequent clinical breast examinations done. So coming to, let's try to understand how or what are the positions one needs to take care of. So breast examination is just a screening process. The hands are usually placed on the waist, or it could be placed above the head, or the best position to do a good examination will be in the supine position. To have a feedback, we could use mirror with the help of right hand. The time duration it usually takes to do a self breast examination is usually 5 to 7 minutes. In the next segment, we'll be also talking about, and we'll be also looking of a demonstration of how exactly a breast examination should be done. So now, whenever you do a breast examination, there are few features you need to look for. For example, you need to look for the symmetry, you need to look for the shape, you need to look for the texture, the masses, the nipple areolar complex, and you also need to look for the changes in the skin. All of these changes or whatever changes you come across need to be well documented, and then the person is asked to again go for a go for a diagnosis test. Coming to the procedure, uh, if we are doing a clinical breast examination, the procedure of which is clearly explained to the patient or the client, you need to have a hygiene maintained. You need to inspect the size as well as the symmetry of both the breasts, looking for the scars if any of them are present. You need to look for the abnormalities in the skin. We need to check for inflammatory signs or changes, and you also need to look for dimpling signs. Now, what exactly is a dimpling sign? We'll be looking in the demonstration part of the segment. We need to inspect the areola for the skin abnormalities, if there are any inflammatory changes, if there is any discharge, or if there is any retractions at the nipple area. This was all about the inspection part. Now, talking about the palpation part, the patient lies in the supine position. The breast is considered to be a whole mass, and it is divided into 4 quadrants with the central area where the areola is there. Use of 3 fingers is made using pad to pad grip, and using pad to pad and not the tip to finger. After taking an informed consent from the patient, you need to squeeze the nipple to look for any discharges. If the client or if the patient complains of any pain, you need to check for the normal breast first. After the assessment, you need to conclude with the session after asking if the person is having any concerns or any questions. So with this, we are done with the theory part of the breast examination. In the next segment, we will be looking towards the demonstration part of the segment. Coming to the next segment of breast examination, we'll be looking at the demonstration of self-breast examination. Before starting, I would like to mention few pointers. Firstly, self-breast examination is now known to be breast awareness. Also, self-breast examination should not be done in isolation, but it is also a part of your regular healthcare checkup. It is done by a healthcare professional. Either it could be a gynecologist or it could be a breast cancer specialist with the help of a mannequin. If you want to examine any client, an informed consent has to be taken from a client, after which you need to explain the procedure of the breast examination from the client. So, as we discussed in the theory part of a breast examination, we will be looking for the examination in 6 pointers. Firstly, looking at the appearance of which, if the breast is symmetrical or it is not asymmetrical. Coming to the second pointer, we'll be looking if there is any presence of mass, if it is soft, if it contains some fibrotic materials. We also need to inspect if there is any eversion or any inversion of the breast, particularly from the nipple area. We need to look for the warmth of the tissue. We need to look for if there is any discharge. We also need to take prior consent and then squeeze the nipples and look for any discharges if present. Coming to the texture, we need to look for the texture of the tissues of the breast. After which we are going to document all of these findings and conclude with the assessment. Coming to the assessment part, we'll be first talking about inspection. But before that, the therapist needs to make sure that his or her hands are clean before starting with the assessment. There is no accessories present. All the accessories should be removed, and post that we'll be starting with the assessment. Coming to our inspection part, we'll be looking at both the breast. We do not see any changes. Coming to the palpatory part, now we will be using 3 fingers here. The pad of the 3 fingers have to be used. Now we'll be dividing our breast into upper quadrant as well as lower quadrant, keeping in mind the areolar and the nipple to be the central region. So from my side of view, this will be my right upper quadrant, this will be my left upper quadrant, this will be my right lower quadrant, and this will be my left lower quadrant. So using the 3 fingers, we'll be palpating for the tissues at the upper, at the outer region, then at the inner region, at the lower quadrant, first at the upper, outer, and then inner. After informing the patient, we are gently going to squeeze the nipple and then look for if there is any discharge present. Also, we are going to make a note of what color the discharge is, and if the patient complains of excess amount of pain, we are going to repeat the procedure on the other breast as well, comparing to which we are going to document our findings in the pointers we just discussed. So with this, we complete our assessment for breast examination. I hope all of you in your clinical practice also include self as well as clinical breast examination practice. With this, we conclude with our PhysioTV classroom for breast examination. I would like to thank Dr. Parag Sanjeti sir, Dr. Manisha Sangvi ma'am, and our principal Dr. Apurva Shimpi sir for giving me this opportunity. I would also like to thank the PhysioTV team for their technical support. Thank you.